This is the Cyprus News Digest with Rosie Haralambous.
On this week's programme, we discuss the results of the elections held in the Turkish-occupied north of Cyprus. Will the election of a moderate leader change the dynamic of attempts to solve our long-standing problem?
Donald Trump suddenly discovers that his path to the Nobel Peace Prize is a solution to the Cyprus problem. With the current ingredients, I don't see a solution of the Cyprus problem on the cards, but I see prospects on the confidence-building measures.
And it's the flu jab season, but should you also consider having a shingles vaccination? It's being recommended by our National Health Service.
My suggestion is to have a jab because then you know what side effects, if you have any side effects, so you can be careful next time. So if you have them a week apart, that's very good.
Elections have just been held in the north of Cyprus, and I think it's fair to say that the result was far from a foregone conclusion. I'm joined on this week's programme by Professor Hubert Faustmann, who's from the Department of Politics and Governance at the University of Nicosia, and also Director of the Cyprus office of the Friedrich Ebert Foundation. Hubert, thanks for joining me. Did you expect this result?
No. I expected Erdogan to win, but I didn't expect the margin by which he won. I think that was the real surprise, that he would win with 62 percentage points. I think hardly anybody saw coming.
What about Tatar? Because lots of visitors from mainland Turkey came along to support his candidacy. He was clearly President Erdogan's choice. So what do you make of what happened?
Well, my reading of it is that he enjoyed, indeed, the support of the Turkish government, but there was no comparison between the interference of the Turkish government in this election in comparison to the last elections, when they were really, really eager to get rid of Mustafa Akinci and decided the elections. This time they did, I think, what they were expected to do, supporting their candidate. But my feeling was that they didn't support him fully, in the sense that they did everything they could. They did what they needed to do. I think they can live with the outcome, and I think they risked the outcome. I think they saw also coming that Erdogan was tipped to be the more likely winner of the elections. And my reading is actually that Turkey can probably live with the result very well, because it gives them policy options that Tatar also included, because Tatar basically did what he was told. But if you want to become more moderate in the Cyprus question, Erdogan is your better choice.
Does that indicate that there's possibly a slight change of angle in Turkey?
I don't know. The statements of Erdogan and other members of the government do not point in that direction. But my hunch is that latest next year, Turkey might want to shift its position and become more constructive. And if this happens, as said, then Erdogan is a more credible candidate to negotiate with the Greek Cypriots.
It's going to put the Greek Cypriots on the back foot, is it not? My first thought was, since Erdogan has been saying that he wants to stick with the federal solution and negotiations need to restart, it's going to leave us in a little bit of a sticky position, isn't it? Because we can't actually blame them again for not coming to the table.
Well, I never understood anyway why Turkey was hardening its position in such an openly obstructive way as they had done, demanding basically the recognition of the North as a prerequisite for the starting of talks, which was a non-starter for everybody. They know that Nikos Christodoulidis is unlikely to make the kind of deal that is feasible. And therefore I always wondered why they're not pushing Christodoulidis to become the obstructive force in the negotiations, and lost the blame game before it even started. So maybe we'll see this part of the negotiations phase now coming with the Turks being more moderate and Christodoulidis starting to sweat.
Where does that leave our president? I mean, what can he do if we're correct in our assumption that basically he pays lip service to a solution, but like his predecessor has no intention of making any deals?
Well, all sides of the conflicts are masters in the time-gaining game. So one is elections. We have parliamentary elections coming up next year. We might have also parliamentary elections coming up in the north. They've always provided the perfect excuse for no progress. The Cyprus EU presidency might be another reason why probably not too much will happen before the second half of next year. And once the negotiations get going, you always find a point where you drag it on, be it rotating presidency or property or security. There are plenty of open questions despite them being close in Gran Montana and both claiming that they will take off the negotiations where they stopped. There are plenty of opportunities to find little things to fight about and drag it on.
And you obviously seem to think that that's exactly what's going to happen.
That's my expectation. I don't think we will have a solution to the Cyprus problem. It's also the weakest player in the game who has become moderate. So first of all, Turkey has to shift its position. Then Turkey has to generally be interested, and these are two very different things. The one thing is to put the blame game pressure on Christodoulidis by becoming constructive, and a completely different game is to know if Turkey is actually really interested in a solution. Should Christodoulidis, contrary to my expectation, actually move along, and we're reaching the final stretch of settlement talks. So there are big question marks in the process, and the safe bet is always to assume that the negotiations will lead not to a final agreement.
What do we know about the new leader in the north?
Well, he has a long track record of being a moderate in the Cyprus question. He comes from the CHTP, that's a leftist party, which again has a long track record of being moderate in the Cyprus question. He has been, I think, very skillful in not alienating Turkey in his election process. He has learned from the painful lesson that Turkey inflicted on Mustafa Akinci. And I think he will be very careful to be in sync with Turkey in all his moves in the Cyprus question. So I think he's a clever politician who is now also in a difficult situation because he stands for a solution, but it might not be reciprocated. And Turkish Cypriots in the last years have become disillusioned with the prospects of a solution after the failure, first of the Annan plan and then the failure in Gran Montana. But they also know that the two-state solution is not on the cards and that the status quo doesn't work in their advantage either, and they will end up being a Turkish province. So he will try his best to get into a constructive direction. He has the personality, he has the positions to it. He's definitely a Turkish Cypriot nationalist in the positive sense, so he will fight hard for the interests of his community, which will make it then even harder for the Greek Cypriots to come to a compromise with him. But he has definitely the mindset with which you could solve the Cyprus problem.
And that seems to be what drove the voters. I mean, this is very reminiscent, is it not, of the percentage who said yes to the Annan plan way back.
I think so, but I think the difference is now. I think also a lot of the people of mainland Turkish descent have actually an interest in a solution of the Cyprus problem. So many of them probably supported him, hoping that as part of the solution, with them holding a citizenship in the north, they might get an EU passport. So I think the electorate is also a bit more complex in as such that mainland Turkish voters have very little to gain from Tatar's position. If you're not a Turkish nationalist and you support the unification of the north with Turkey, then you vote Tatar. If you look at your own interest and think I might get a new passport, voting for Erdogan was a rational choice.
Yeah, I was going to ask you how far you think that, I think one of Erdogan's pledges, as it were, or one of the things that he was emphasising during his campaign was the fact that EU membership would be lost if the North became part of Turkey. And there's quite a lot of people in the North who already have that EU citizenship, aren't there?
Yeah, they're citizens of the Republic of Cyprus. So we don't know. It would take a fully fledged annexation by Turkey that's recognized by the international community for Turkish Cypriots to lose their passports. But for those who would get citizenship of a reunified Cyprus but are not citizenship holders of the Republic of Cyprus, a solution is clearly attractive.
What's next, Hubert? I mean, I know it takes a little bit of time for a new leader to get his team around him. Have you had any indication of who he might pick for which jobs?
I heard rumors, but now the name eludes me, of who's likely to be the negotiator. I'm bad with names, so we have to skip that part in the talks, in the interview. But what's next is the enlarged meeting with the UN in about 4 weeks' time, where he will try to strike a different tone. But I think what is interesting is to see to what extent Turkey will accommodate him in the next round of talks and will soften its stand, or will there be an open divergence of views at the next meeting with the guarantor powers and the leaders of both communities? I think the really interesting question is how we'll succeed in his balancing act of becoming more constructive without undermining the official Turkish position, insisting on a recognition of the North as a prerequisite, which is a non-starter.
And of course, Turkey at the moment is rather busy with its role in Palestine. Now, how does that play into all of this?
Well, in the end, it could be positive in the sense that there's a rapprochement between Turkey and the US. There might be a rapprochement between Turkey and the European Union. And within that framework, policymakers in Turkey, and in particular Erdogan, might come to the conclusion that a more constructive stance in the Cyprus problem just supports this rapprochement. So I think there's more hope in engagement of Turkey in the area than this is becoming a problem.
While I've got you on, Hubert, and I mentioned Gaza, can I also move over to that situation at the moment? News is breaking almost daily about the ceasefire not being upheld. Do you think it can, or are we on the road back to full-scale hostilities?
It's hard to tell. I mean, the deal looked so unlikely to be implemented that, pessimists are always probably proven right in the Middle East. There's still an opportunity, but it will depend decisively on the US and on Donald Trump to keep the pressure up on Israel, not to undermine the deal, or on Hamas. There are so many ifs, so many question marks that, again, a bit like in the Cyprus question, pessimism is always realism. But it's the only chance they have. If it's full-stage violence or low-scale violence, that to me is the decisive question of the next weeks. And then we come to the disarmament of Hamas and the spoilers, being Netanyahu, being the radicals in his cabinet, or Hamas not getting it their way. And that's going to be a really, really big task for all the players involved in the region. Everybody else is on board for that deal. So to contain those spoilers, that's the task. And it's going to be very hard.
It's down, basically, isn't it, to how far President Trump will allow Bibi leeway, because it does seem that they're looking for excuses to bomb, or indeed recently they shut all aid again, and I think we're told to open it up. But it's only being partly opened up, isn't it?
Yeah, Netanyahu is seen as having no interest in this deal to hold. He needs to delay elections as long as he can. He needs to keep the society in this stage of emergency as long as he can. Hamas has some interest in the implementation, but no full interest either. But at the moment, it seems Israel is more likely to undermine the deal than Hamas.
What credence do you give to these reports that clans in Gaza particularly, but generally in Palestine, have been armed and funded by the Israelis, basically to stir up trouble, and it seems that perhaps they were the ones who were looting the aid in the first place?
Well, what we do know is that basically the Palestinian mafia organized crimes were approached by the Israelis and were involved in these looting activities. So, the Palestinian community is not a monolithic bloc. There are lots of subgroups, and there are criminal organized interests that apparently have been approached by Israel. I have no reliable information on that. If they're used to undermine the deal, exceeds my level of knowledge. But it's clear that Israel has cooperated with some less laudable elements of the Palestinian community that was involved in looting of food deliveries in the past.
Okay, and back to Cyprus. Are you optimistic that things might change, or are we just going to trample the same path?
Well, as far as the chances for reunification are concerned, I remain very, very pessimistic. I think the chances are more on the confidence-building measures side, that there might be progress on the crossings, on the photovoltaic, that there might be a possibility to find an arrangement that allows the exploitation of gas off the coast of Cyprus. I think these are the issues which we should focus on. If, contrary to my expectations, there are constructive dynamics and things fundamentally change in Cyprus, and Donald Trump suddenly discovers that his path to the Nobel Peace Prize is a solution to the Cyprus problem, or the Erdogan government suddenly sees an interest in a solution of the Cyprus problem, and then the Greek Cypriots play along, and these are lots of ifs, then we're talking. But with the current ingredients, I don't see a solution of the Cyprus problem on the cards, but I see prospects on the confidence-building measures front.
Well, I suppose it's where we've been for the last 50-odd years or so. Professor Hubert Faustmann from the Department of Politics and Governance at the University of Nicosia, also Director of the Cyprus office of the Friedrich Ebert Foundation. Many thanks for your time.
Thank you, Rosie.
This is the Cyprus News Digest with Rosie Haralambous.
The biggest achievement of Crime Stoppers has been the ability of the public to be able to give information about crime anonymously.
There's no way I could have kept prostituting without the drugs. There's no way I could have had my body used like a public toilet, because that's actually what prostitution is.
And then the fourth series I started 3 days after I'd won the Oscar, so the whole of the Monarch of the Glen experience was all interplatted with the Gosford Park Oscar experience.
I was working with Ronnie James Dio, and David was going to reform Whitesnake in 2003.
Cyprus was chosen because Cyprus is a stable, peaceful and secure place.
We have to really look closely. What are we doing with children? What are we doing with adolescents? And what are we doing with adults that can help them move into a more literate situation?
The ones that I'm proudest of are the ones that were true discoveries, where we found something we didn't know existed.
Our National Health Service came out this week with recommendations that people over a certain age should seriously consider getting a vaccination against shingles. Now, I know shingles has something to do with chicken pox, but to get the lowdown, I've come to my GP, George Samudis. He also teaches at the University of Nicosia Medical School. George, how common is it for people, first of all, to get shingles? Because it is a connection with chickenpox. I think if you had chickenpox as a child, is that right?
Yeah. So the annual incidence of herpes zoster, it's between 1.9 cases to 4 cases per 1,000 population.
So it's not very common?
It's not very common. It decreases with age, of course, from fewer than 2 cases per 1,000 among people under 50 years to 11 cases per 1,000 among people aged 80 years or over. The incidence, it's good to know that it's higher among women. And it's also higher in people with immunosuppression, which means those with malignancies, cancer, HIV, chemotherapy, or taking steroids. They are in higher risk.
How do you get shingles? Because it's not transmitted, I think, from person to person, which I think chickenpox is. I seem to remember as a child going to chickenpox parties because our parents wanted us to get it. Is that still the case?
Yeah, herpes zoster results from reactivation of latent varicella zoster virus. So when you go through chickenpox, then the virus can go to your dorsal root or cranial nerve ganglia. There can be reactivated the varicella zoster virus, and then you develop shingles. So varicella zoster virus, it's a double-stranded DNA herpes virus, which spreading from direct person to person contact with an infected individual or lesion and from air droplets. So this is the chickenpox, okay? But when you go to herpes zoster, then...
and that's the shingles one.
Yeah, so herpes zoster and chickenpox or varicella are both caused by the same virus. But varicella usually follows the initial infection and causes a generalized rash, whereas herpes zoster occurs after a reactivation of a previous infection with the varicella zoster virus and tends to be localized to a specific nerve distribution.
That's where you get the rash, which I'm told is very painful. I mean, can you tell me a little bit about what people should be looking out for? Because I think that it is at the moment quite prevalent. And maybe people think, oh, I've got a mosquito bite or something, it's a rash, why is it so painful? But they should go for medical treatment pretty quickly, shouldn't they?
Exactly. We give them the antiviral medications. But the pain usually is localized. It's localized in a dermatome. So the character of the pain is burning, is itching or tingling, and can range from mild to severe pain. So the pain is localized to the affected dermatome and can precede the rash, the pain, by days to weeks. So for a couple of weeks, you may have a couple of days before the pain with no rash, and then the rash coming. So the most commonly involved ganglia are the thoracic area and trigeminal nerves.
No, tell us that in ordinary language. Thoracic is the chest.
Yes, and the face.
Okay.
The itching is also something quite common. The rash, as we said, which is the rash is the appearance of clear vesicles.
It's like blisters, isn't it?
It's blisters, yeah, thank you.
But then in chickenpox, I think I'm right in saying, you could pass it on as long as the blisters were there, but once they'd scabbed over, you were no longer contagious.
Yeah, when they form crust, then you're not contagious.
But what about the shingles one? If you get blisters with that, we can't pass it on to other people, even if the blisters are oozing.
Yeah, you can pass on the varicella. Let's say you can get a chickenpox from, but no herpes zoster.
So if I've had chickenpox and I get shingles, and you haven't had chickenpox, you can catch chickenpox from me. But if you've had chickenpox, you're not going to catch shingles from me. I mean, there is a clear distinction here.
Yeah, you can pass on if somebody hasn't gone through chickenpox and through the vesicles fluid, then you may catch. It's quite not so common, but it is something that may happen.
How many people in Cyprus, if you know, have had the chickenpox virus? I mentioned earlier that when I was a youngster, you used to go to chickenpox parties because your parents wanted you to have all these childhood illnesses and get it over with. And so the majority of people my age probably have had chickenpox and are perhaps vulnerable to shingles. Is that the case in Cyprus, or have we not any longer got that childhood chickenpox done with, and so you might have a whole load of adults now going to catch chickenpox?
Yeah, because of the vaccination now, the children vaccination strategy, the national strategy, the coverage is very high of people that they have been vaccinated or they have been naturally got antibodies for chickenpox.
And does the vaccination that you had as a child last you your lifetime?
Usually, yeah. So let's go now to the prevention and go back to the vaccines. So the vaccine that Cyprus is offering through the ESC, the NHS, is the shingles, which is a non-live recombinant adjuvanted vaccine. So this can give you a very high protection, and this is quite amazing. The protection can up to 95%, so it's quite high. The protection can give you,
but it could also give you some pretty nasty side effects. So let's talk about those.
We'll talk about that. Before that, just to know that it's through an intramuscular injection. You give 2 doses to be separated by an interval of at least 8 weeks. So we suggest to take it between 2 months and 6 months, no more than 6 months, the second dose. You do have a couple of side effects if you have them. We know that all the vaccines, they have some side effects. Not something serious has been reported commonly or very commonly. So if we go to common or very common side effects, the list goes to mild abdominal pain or some appetite decrease, some arthralgias, joint pains or fatigue or mild fever or headache, nausea or vomiting.
Is there any time you shouldn't have this vaccine? Obviously not if you're ill yourself already, and you mentioned immunocompromised people, but the average population, is there anything they should think, okay, I need to put this off a few weeks?
Yeah, but if you get immunocompetent and you have gone through, let's say, fever, illness, or you have a lower or upper respiratory tract infection, especially with fever, you should avoid that.
And it's coming to the time of year when a lot of people get upper respiratory tract infections and so on.
This period, yes.
So let's talk very quickly, as if we may as well, about the flu jab, because it's that time of year when most people are being called by their doctors, especially again the elderly, to have a flu jab to see them through until, let's say, the spring. And each year I think it's a different flu jab. A lot of people say, oh, well, I had that last year, I'm fine. But it's not always the same strain of flu, is it?
Yeah, every year a different strains is cultivated. It's egg culture cultivation of the influenza vaccine, and it's different from the previous year, the strain, so it's advised every year to have your flu vaccine, especially if you are immunocompromised or if you are in the category of elderly population.
So you have your flu jab, but you don't do it at the same time as the shingles jab.
I would advise in a different, let's say, time. I would suggest that.
So a gap of how long? A month? 2 weeks?
So usually they say it can be administered at the same visit as the influenza vaccine. So you can have the herpes zoster and the flu vaccine at the same visit. Studies show no significant increase in adverse reactions. You need to use different injection sites, of course, so different arms.
But you recommend having a little gap?
Yeah, my suggestion is to have a gap, because then you know what side effects, if you have any side effects, so you can be careful next time, and you know what had caused
you know
which
which is
effects.
which.
Yeah. So if you have them a week apart, that's very good.
Finally, let me ask you, if you actually get shingles, obviously there are medications, I presume they're antiviral to help you through. Does anybody ever get it badly enough that they need, for example, hospital admission, or that they're completely unable to function properly?
Yeah, most of the cases we give them oral antiviral therapy. We need to start that within 2 to 3 days of rash onset to be effective. We give them usually for 7 days, except if there's eye involvement of the eye, then we give it for 10 days. And we don't have any side effects usually, and the patients they get better and fully recover.
In what sort of time frame?
Usually after they finish the course, they feel much better. And what is important is to prevent the complications. So post-herpetic neuralgia is what we want to avoid. That's why I want to start within 48 hours to 72 hours. We would like to start the antiviral medication, so we prevent the post-herpetic pain, which is the most common complication.
Yeah, a lot of people say it's absolutely excruciating. We've got to wrap this up, George. So basically, if you get a rash or you're feeling unwell, check it out with your doctor, just in case it turns out to be shingles, which apparently is on the rise again and doing the rounds. We've been talking to Dr. George Samoudis about shingles and that recommendation from the ESC to get vaccinated. Well, that about wraps up this edition of the Cyprus News Digest. Many thanks for your company. Hope you'll join me next week. Till we meet again, take care and God bless. Bye-bye now.